Hi, I'm Dr. Gunnarsson with TMJ and Sleep Therapy Center of Utah, and I'm here with Mindy Lunsford, our myofunctional therapist. And this is TMJ Unlocked, our podcast that we do weekly. And if you like us, please like us and follow us. We appreciate all of the streaming and the traffic that we get. We just recently posted. Today's kind of off topic just a little bit, but we recently posted a YouTube video on the use of the didgeridoo to help with sleep apnea. Got a lot of responses from this last one. We've done this is twice. We did kind of a follow-up of the didgeridoo, and it's really interesting, but we got some responses we wanted to respond to, some questions that some people asked, and want to make sure that we get to those. And then I do want to talk about the study because it tells a little bit about answering those questions. It tells a little bit about what that didgeridoo actually does and what the study actually covered. So, Mindy, what questions did we get to our video?
Well, we did have some viewers that were asking if there were instruments other than the didgeridoo, such as like the trombone or woodwind instruments or the tuba, if playing those instruments give the same benefits that the didgeridoo has.
You know, that's an interesting question, because I don't think there's been a study done on other instruments. I think the only study that was ever done was on the didgeridoo, which is interesting enough why I choose the didgeridoo in the first place. But I can't really say. I'll go into the study and talk a little bit about what it did and how it affected and why its effects help with the sleep apnea issues. But as far as other instruments, I think it would be interesting to do a study on people who play musical instruments compared to people who don't.
Absolutely. I do think that would be a very interesting study.
Even a questionnaire for people, you know, from symphonies and orchestras and band groups who are, you know, as adults playing these instruments, have been playing them for years. Are they at higher risk for sleep apnea? What are their sleep studies look like compared to people who don't play any instruments at all or never played an instrument?
Right. You'd think there'd be a big enough pool that we could pull from, that it's not something that would be a brand new study starting from scratch. There should be enough information out there that if somebody was able to do a study, they can pull that from.
Yeah. So that would be interesting. So if you're into doing studies, do a study. Figure it out for us. Let us know. We'd love to know too.
Right. Now, this study showed that the didgeridoo helped with sleep apnea. We had a question also, someone wondering if it also helps with the TMJ.
So again, the study didn't go into the jaw joint itself, but we know that a lot of sleep disorder breathing leads to clenching and grinding, which is parafunctional activity, which affects the jaw joint itself. So I think that there could be some correlation to preventing TMJ issues by preventing sleep disorder breathing. Those two tend to go hand in hand, but not always. TMJ is always a symptom of sleep apnea.
Right.
So yeah,
that's what we've seen in our office for sure, is that some people have both issues. Some people have one, some people have the other, but we do see a lot of hand in hand, like you were saying.
So it would be, again, interesting to see how many people actually have TMJ issues and if that helped resolve any of them or prevented them. I think it would be more along the prevention lines than, you know, once you get that jaw joint back into good health, it would help prevent having it go back to the way it was.
Right. All right. So we had another viewer of your didgeridoo playing video that was curious if it was the that cyclical breathing of playing the didgeridoo instrument that's responsible for helping with the sleep apnea.
Again, I'm not sure it had to do with specifically circular breathing. I do know that based upon the study, it had to do with strengthening those tissues in the upper airway. And if cyclical breathing affects that and strengthens those, then definitely that it was the cyclical breathing that was doing it.
But we know for sure it was the strengthening of the muscles.
Yes.
In the oral cavity.
Yeah, not just training on breathing. It was the actual strengthening of muscles.
All right. And so let's get into that study then and see exactly what it was about.
So I'm going to explain a couple things. This study was done in 2005, 2004, and was published in February of 2006. It was a randomized study that was done over a 4-year period where they had people come in and learn the didgeridoo, and they tested them beforehand. asked them their sleepiness, did the Epworth sleepiness scale, which is a scale that just shows us where you fall in falling asleep during the day doing certain activities. So they had them fill that out, and then they had them practice the didgeridoo for 4 years. And those people who practiced it compared to the blinds,
The control group.
the control group,
Yeah.
those who practiced it, they saw a decrease in their symptoms. So I wanted to read this little section in here that kind of just tells that specifically, but it says, in this randomized controlled trial, we found that 4 months of training, so just 4 months of the training of the upper airway by the didgeridoo playing, reduced daytime sleepiness in people with snoring and obstructive sleep apnea syndrome. The reduction of the apnea-hypopnea index by didgeridoo playing indicated that the collapsibility of the upper airway decreased. In addition, the partners of participants in the didgeridoo group were much less disturbed in their sleep. So here we have the AHI index, which is the hypopneas, the apneas, any event that has a irregular breathing associated with it. That index actually went down in people who practice with their didgeridoos. I thought that was really cool to hear just even that. Not just the symptoms have decreased. I don't feel as tired during the day. I'm not waking up as much during the night. But to hear that overall, that scientifically there's evidence and proven evidence based that says that this actually had something to do with improving them. So interesting study. We can post a link to the study if we want to, and that would, give people an access. They can go back and they can read the study themselves. Fascinating. The whole reason for this study and the reason why it was done is because they're trying to find ways to help people be more compliant in helping them with their sleep disorder breathing. And they found that didgeridoo gave enough activity and interest that people were willing to do it more than people who would wear their CPAPs. And so we're trying to find ways in our efforts of helping you with sleep. How can we help you be more compliant? What are some easier ways we can help you when you're sleeping? What can we do to help you be more comfortable at night so that your sleep is much better? So with that, I will close and say thank you for joining us. Again, like us and follow us. And we love to do these and give out information to get as much information out there as we can. The more information we get to people, the more knowledge people are going to have in treating their own sleep apnea and things that they can take back to their doctor, definitely, and talk to them about. So thank you again for joining us. Thank you, Mindy, for being with us today.
Thank you, Doctor.
All right.